My name is John Fang, and I'm one of the authors on the enteral feeding CPU. I'd like to introduce Dr. Dan Micic, who is the lead author for this most excellent CPU.
Thank you, Dr. Fang. One of the reasons we put this CPU together was to discuss some of the challenges related to enteral access. One of the things that we see in gastroenterology now is that a lot of people like to gravitate to new techniques, trends, and developments. Unfortunately, there's little new in the practice of enteral access, but it's clearly in the armamentarium of most gastroenterologists and a needed practice, particularly in the hospital setting. As we have more individuals living longer with chronic conditions and individuals suffering from the after effects of therapy, such as radiation, we cannot overlook the risk of malnutrition in these cases. All too often, the development of malnutrition does not go recognized by providers, which contributes to patient morbidity. Having a stable feeding plan is critical in these cases. Dr. Fang, along the lines of living with chronic conditions, we are seeing more individuals with a history of foregut surgeries, abdominal mesh, ascites in the setting of cancer, all things sometimes considered as relative contraindications to tube placement. How do you approach tube choice and placement in your practice?
That's an excellent question and concern that we are facing more frequently. We highlight in the CPU, and there is lots of uncontrolled evidence that these relative contraindications to enteral access that we are seeing more and more commonly are not absolute contraindications. And with adherence to best practices and as included in our CPU paper, that in many, if not most cases, enteral access can be achieved in these patients. And we have, again, put and referenced those in our CPU document. Let me ask you this now that a gastroenterologist has placed enteral access, what is your approach to follow-up of those patients?
Of course. I think one of the most important pieces in the CPU, outside of tube choice and method of placement, is really the focus on follow-up and management of complications. Excessive tension on the bumper, inappropriate feeding methods can all lead to predictable complications of buried bumper and tube clogging. So my focus in patient follow-up is to meet with the patient in a multidisciplinary team setting with our dietitian and nutrition support team in short order after placement to make sure that they are using the tube correctly, the positioning feels good, and that we can ideally prevent the typical complications before they arise.
Dr. Micic and I would like to thank you so much for listening, and I hope you find our CPU helpful and informative.